This morning I'm going to talk a little bit more about these 2,170 tuberculosis cases that were reported in California in 2013. Now, as Michael said already, this was a historic low in California and capped 10 years of annual declines. However, it was less than a 1% decline compared with 2012. And as I think you can see from this slide, which shows one symbol for each case of TB that we diagnosed in California, we have a lot of work to do. Michael said that this translates into one TB case being diagnosed every 4 hours during 2013. And California reports the most TB cases in the United States, and our case rate is 5.7 per 100,000, nearly double the national case rate. But not everybody is equally affected by TB. So more than 3/4 of these cases were among persons born outside the United States. And among these foreign-born persons, the rate of TB was 10 times higher than the rate among US-born persons. In addition, 37% of these foreign-born cases had a medical comorbidity, putting them at risk for TB. And these consisted of HIV infection, treatment with other immunocompromising treatments, kidney disease requiring dialysis, and the most frequent medical comorbidity was diabetes, which occurred in 28% of our foreign-born TB cases. So this is a population, foreign-born persons, especially foreign-born persons with a medical comorbidity, in whom TB prevention efforts are particularly important. Like has happened in other years, there were 59 pediatric TB cases in the youngest children under age 5. And not only do these cases can result in severe disability and consequences, but they're also a sign that TB is being transmitted here in California. It's not the result of transmission elsewhere, but it's occurring here in California. So this translates into a child under 5 diagnosed with TB every week. So in 2011, the last year for which we have updated numbers on deaths, there were 215 deaths among persons with TB in California. This means that a California dies with TB more often than every other day. And these 215 cases were almost 10% of all the TB cases diagnosed in California that year. And in the yellow, you can see that 1/4 of the persons who died actually before even having a TB diagnosis or getting treated for TB. And for those patients, the TB diagnosis came too late. So a major challenge that we face is the challenge of drug-resistant TB. So both multi-drug resistant TB and extensively drug-resistant TB are difficult to treat because they're resistant to the most effective TB drugs. What this means is that those cases need to be treated with more drugs for a longer period of time. And that constitutes a regimen that's more expensive and less effective. In the last 10 years, most California counties that report TB have had at least one MDR-TB case. In 2013, there were 26 MDR-TB cases, and in the last 10 years, there were 9 XDR-TB cases in California. And although we haven't seen a sustained increase in MDR-TB in California yet, MDR-TB is increasing globally. So another challenge, but that's also an opportunity, is the large reservoir of silent infection that represents our future TB cases. So we estimate that 2.4 million Californians are infected with TB but are not sick with TB. And these persons can progress to active disease, the form of the disease where they could spread it to others and are sick themselves. So as Michael alluded to, we can do something about this progression to active disease. We can have patients and their doctors talk about whether there's risk for TB. If there's a TB risk, testing for TB infection, and if TB infection is present, treating for TB infection. And if we're able to do this effectively, together we can get to the vision of California that's free of TB deaths and free of TB cases. So for more data, look in your packet or visit